I think that there have been two conflicting things about this crisis, and it is far more a crisis of politics and culture than it is a crisis of health. One is the lack of humility of the governing classes and the government in particular, by which I really mean the civil servants who are running the country. And let us be in no doubt, we are not governed by democratic politicians. They have put public health officials in charge. And that in itself is a democratic crisis of extraordinary ramifications. They have a lack of humility, but there is also too much humility by everyone else. And again, that goes back to the monomania that we have seen over the last 16 months. Because people say, you are not an epidemiologist. And of course, you are not an epidemiologist. So you do not have the very specific, specialized field of epidemiology. But we need to approach this in a multifaceted, multidisciplinary way. This is about the whole of society, the way that the whole of society runs. And the idea that you can change that by secondary legislation imposed by ministerial fiat with no debate in Parliament, because we're not talking about the Coronavirus Act, which was an act. These were all regulations, were all put, including masks, all put under the Public Health Act. The idea that you can do that is an extremely disturbing one, and as I say, contrary to all precedent, and contrary, frankly, to the functioning of a free society.